Hello everyone. Today in this video I'm going to tell you the details of hepatitis B vaccine. This is a subunit vaccine derived from the viral surface protein antigen. And this vaccine contains the preservative thiomycin and adjuvant aluminum side. This vaccine is heat stable and should be stored between 2 to 8 degrees centigrade temperature. Should not be frozen. If accidentally frozen, then we should discard this vaccine. This vaccine is available as a single dose or multi-dose vial. Now, what is the dose, route and site of administration of this vaccine? In less than 18-year age group, we have to give the 0.5 ml dose intramuscularly. And in more than 18-year of age group, 1 ml is the dose. And in less than 3 years age group, intramuscular we have to give in the anterolateral aspect of the thigh. While in more than 3-year age group and in adolescent, we can give this vaccine in the deltoid muscle also. This vaccine should not be given in the gluteal region because of low immunogenicity. If accidentally given in the gluteal region, then we have to repeat the dose of this vaccine. Now, what is the schedule of this vaccine? In more than 18-year age group, we have to give the 3 doses 0, 1, 6 months. So first 2 doses should be given at 4 weeks interval and third dose should be given after 6 months of the first dose. So 0, 1, 6 is the schedule. In National Immunization Program, we are giving the 4 doses. Birth dose as early as possible within 24 hours of the birth. Then other 3 primary doses we are giving in the combination with the diphtheria, tetanus, pertussis and H. influenzae in the pentavac vaccine, Panchgudi Rassi. So at 6, 10 and 14 weeks, we are giving the pentavac vaccine. So in this hepatitis B vaccine is present. What are the adverse effects of this vaccine? Hardly there are few adverse effects. Sometimes pain, erythema at the site of injection can occur in hardly 1 to 3% of the patients. And sometimes fever can occur in 1 to 6% of patients. Anaphylaxis very rarely in 1.1 million cases. So whenever there is a anaphylaxis to the previous dose, this is a contraindication to repeat the dose. So what are the contraindication? First contraindication is whenever patient is having any allergy to the any component of this vaccine, or having the allergic reaction or anaphylaxis to the previous dose of hepatitis B vaccine, this vaccine should not be given. Now, various things asked in the Viva also, and you should know how to assess the efficacy of this vaccine. So, whenever we are doing the vaccination, after completing the schedule of the vaccine, example, in more than 18-year age group, if we are giving the 016, then after 1 to 3 months of the last dose, then after completing the vaccination with the hepatitis B, we have to keep the gap of minimum 1 to 3 months. Then we have to send the anti-HBs antibody titer. If this titer is more than 10 milli international unit per ml, that means patient has developed the immunity to this. This vaccine is T cell dependent. That's why memory T cell also develop after this vaccination schedule. So whenever antibody titer is less than 10 milli international unit per ml in a vaccinated healthy child or person, need not to repeat the schedule of this vaccine because they are also having the memory T cell which is protective in spite of antibody titer has gone less than 10 milli international unit per ml. But what are the conditions in which we have to repeat the dose, or what are the conditions in which it required to give the booster of hepatitis B vaccine? Routinely in healthy person, need not to repeat the booster vaccine. Only we have to give the 3 doses 016. After that, need not to give the any booster and need not to do the post vaccination this antibody titer also. But in some situation, we have to do the post-vaccination, this antibody titer also, and we have to give the booster whenever titer goes less than 10 milli international unit per ml. So what are those conditions? Example, if the patient is HIV positive, if patient is having the chronic renal disease, chronic liver disease, cystic fibrosis or celiac disease, in such condition, patient require the booster whenever antibody titer goes less than 10 milli international unit per ml. And also, if the baby is born to the HPS antigen positive mother, then also post vaccination we have to go for the antibody titers also and HBs antigen status also.